Hey everybody, it's Dr. Pam Johnson, Pet Lovers United. We are in Mexico, as you can see. We're on the Baja, and I'm not going to talk about what I was thinking about because we're here with some friends this week, and one of them, Holly, brought up that their dog, Ruby, was having some GI issues, some intermittent diarrhea, so accidents in the house. 15 years old, and so we just kept talking about it, and then all of a sudden it occurred to me to ask the question: have you noticed any change in water intake and urination? And they said, yes, we have. She's having accidents in the house. And I went, okay. So when we talk about GI, we always think about, dietary indiscretion. I ate something I shouldn't have, and it can just happen when they get older. But one of the things that we need to be looking at is there any other changes? She's been on the same diet her entire life. And so, it's not unusual to have some intermittent GI issues. After all, we can't eat the same things we did when we were teenagers and get away with it. And dogs and cats are kind of the same way. So you have to really dig deeper when you're trying to figure out why might this be happening, and what are some things that we might be able to do about it. But when we found out that she was drinking more water and urinating more, even having accidents in the house, it occurred to me that she might be developing something called Cushing syndrome or hyperadrenocorticism. Now, that's not the only thing that can cause PUPD, what we call PUPD, which is increased water intake and increased urination. Your veterinarian might use that phrase with you. It's literally polyuria, polydipsia. Too much information. But anyway, if you start noticing some of those symptoms in your older pets, there are things that you need to be thinking about, and conversations that you need to have with your veterinarian. And one of those is, what might be causing my pet to be drinking more water and urinating more? Because your first instinct is we need to, keep them from drinking more water. But that's not going to change things if they have an adrenal gland issue or Cushing syndrome, which causes them to drink more water and urinate more. It can be addressed. And again, it's something you want to talk with your veterinarian about. But I wanted to touch on, so you're going to notice things way before your veterinarian, right? So if you start seeing that the water bowls are being emptied quicker, you're having to fill them up more frequently, or they're having accidents in the house, you want to think about, okay, could my pet be developing a UTI? This is, dogs or cats. Diabetes, dogs or cats. Cushing syndrome, it is diagnosed in cats, just not as frequently as it is in dogs. Again, that's an adrenal gland issue. And then urinary tract infections in older patients. I gotta bring that up because it's so important that you get a full, what I would call senior panel. That includes a complete urinalysis looking at sediment, looking for things like protein in the urine, concentration. Hey, everybody, thanks for joining, those that are with us live. So I really, really wanted to make sure that we're focusing on the little things, because these aren't minor issues. But the earlier we detect them, the better off we're going to be, and the better off our pets are going to be. So if you're seeing changes like that, don't ignore it. I would say track it. Follow, like, how often are they having accidents in the house, and how much water do you think they're drinking? So those are things that I start thinking about. Okay, we need to catch this early, because the earlier you catch it, like anything else, the better we are and able to address it. We want to make sure that this isn't early kidney disease showing up. So, these are things that again, I wish all pet owners knew, right? Here are the things that I wish you knew. And as a pet owner, before you ever, came into my door. And I think that your veterinarian will also love the fact that you're bringing these things up early and you're being proactive. This is not about overreacting at all. This is just being proactive, right? This is what we're all about. Quality and quantity. Quality and quantity. We want to make sure that we do everything we can to keep them here longer. And if you're wondering whether or not something's abnormal, it probably is. Trust your instincts. Trust your instincts. They don't tell us, right? They don't tell us that they're sick, but they do show us in subtle ways. And this is one of them, where they start, having some GI issues, and they start, subtly having, drinking more water. I got to go out more, those kinds of things. So it's really important that you're watching those things. And if I'm wondering how many people out there, I want you to really think about this, but either with your pet now or earlier, if you've ever had a dog or cat that you started going, gosh, I'm having to fill that water bowl up more than I used to. And, what does that mean? So be curious, ask questions, talk to your veterinarian sooner rather than later. And most importantly, love them up. We are having a blast here in the Baja. We've seen some whales. I'm going to turn around here. We've seen some whales here. We've seen some rays out in the ocean. A lot of fish, but mostly just God's beauty. Can't wait to see you guys next week. Facebook Live. I promise I'll keep getting better at this. Love them up.